Thank you very much for the invitation. These are my disclosures. I'm going to talk to you about 56 Dean Street, which is, we think, the busiest sexual health clinic in Europe. And I'm going to explain how we've integrated rapid diagnostics within the service and how that's evolved for both sexual health, but also HIV care. And at the end, I'm going to talk to you about some digital health promotion that we've been doing as well to target, in particular, the gay population in London. So this is 56 Dean Street. As you can see, branding is very important to us. We serve a very diverse community in Soho, which is in the centre of London. On the bottom left-hand corner is the building, which is 56 Dean Street. That's its address. That's the name of the service. The first two floors are where we see people historically for screening, but also symptomatic sexually transmitted infections. The third floor is people with more complex problems, including HIV, where they're followed up on that floor, and the top floor is more for administration. Now, 10 years ago, we needed to expand our service because we were very busy, and we decided to open Dean Street Express, which is on the bottom right-hand corner of your screen. That is our service, which initially was for asymptomatic screening using rapid diagnostics. And now I'm going to explain in detail what we do there and how that service works. So this is inside Dean Street Express. I think you'll be struck initially by how it doesn't look like a classical clinical service, and that's deliberate. We wanted to make it welcoming for our users. So what happens is patients come in, they have a card, their Dean Street Express card with their clinic details, their number on it, and they access the computer system straight away, and they put their history into that touchscreen. So there is no paper involved whatsoever. And depending on the history that is given, depends on the swabs and the tests that are done within the service. So for gay men in particular, we'll do triple site testing for chlamydia and gonorrhea, which is self-sampled. Patients do it themselves using the swabs that are given to them, depending on the history taken from the touchscreen that I just explained. There are dedicated booths at the back of the service with videos showing people where to take the samples. So if you have a look here, this is how to do a throat sample. The individual swabs are marked with the site where the sample needs to be taken. So there's a rectal swab there. And for women, we do vaginal swabs, of course, and there's also a video demonstrating how to do that. Now you'll see that the actor here has a pod in his hand, and when all the samples are self-taken, they're placed into the pod, and these pods are then taken directly to the on-site laboratory. Now, this is a Gene Expert Infinity machine, which has a number of pods on it, and each pod can process a sample for chlamydia and gonorrhea testing in real time. And this is in 90 minutes, patients can get their results. Again, this is all automated, and once those results are obtained from all three sites in a gay man, then the system, the computer system where the history is taken, receives the results and directly texts patients to their mobile phones. So on a good day, you can be in the clinic and get your results within 90 minutes, which is absolutely amazing. Now, blood tests are also done in the service. They're not processed on site, but they're processed near site. So HIV tests, hepatitis C and B testing, and syphilis tests are taken up the road. The company that processes those can get results in 8 hours. So you can get the results of your asymptomatic screening within 8 hours. This is an example of lean processing. So before, patients would come in, they'd write their details on paper, these would be transcribed, and then patients would get their results from a person obtaining the results through various computer systems. And this was error prone and took up a lot of time. Now, Dean Street Express, everything is automated, so results go directly through the system and no one needs to check them because the checks are inbuilt. And that saves not just time, but resources within the clinic, because a lot of time was spent correcting the errors that were done on paper previously. So I told you before that all results were within 8 hours, and actually look at this. So the bottom graph there is that before Express existed, asymptomatic screening results were given within 9 days, and now they're within a matter of hours. And this has real consequences for the public health surrounding asymptomatic screening, and there are cost savings to be made for giving people results earlier, and you can read about those in the paper, which is cited below. It's no surprise to me that patients like this, they get the results very quickly, they're in and out very quickly, and this shows, you know, a rolling average of the demand on the service, and it increased. People were using Dean Street Express DSE here, and what it also showed is that we were able to see the same number of symptomatic patients at 56 Dean Street. So the whole service expanded with no extra staffing resources, because patients were doing most of the testing themselves. Dean Street Express evolved because increasingly symptomatic screening was being done online or through postal testing. And actually then the advent of PrEP happened around 5 or 6 years ago. PrEP monitoring is very similar to just the asymptomatic screening that we do at Dean Street Express. It is all those screens that we talked about, the chlamydia and gonorrhea testing, the blood tests, but a renal function, a U&E, and a urine dipstick. So it was very easy for us to incorporate that monitoring every 3 to 6 months into Dean Street Express. And that's why at the moment, we estimate we have 15,000 people annually coming in for PrEP monitoring in that nurse-led service. This is the 3rd floor at Dean Street. This is the clinic reception. And there in the corner behind the water cooler is another touchscreen, not unlike that, in fact, the very same as at Dean Street Express. So when people come in for their HIV care, then they can also do a screen for sexually transmitted infections by entering their data into the touchscreen. It's the same computer system. But in addition, we're able to do rapid viral load testing from our near-site laboratory, and patients get their results again within hours. So actually, a lot of the monitoring which we do in every 6 months at Dean Street is done using the same system. It's very lean and includes rapid diagnostics. So it just shows you can incorporate rapid diagnostics in lots of different ways in your service, albeit for sexual health, albeit for HIV monitoring. I want to talk very quickly about Dean Street Prime. So we know at Dean Street historically that there are a subset of gay men using our service who had about a 1 in 10 chance of becoming HIV positive in the next 12 months after attending for a rectal bacterial infection such as gonorrhea or chlamydia, having an early syphilis infection, and having coming in for PEP. But also those that told us that they were having condomless receptive anal intercourse in the last 3 months. So we came up with Dean Street Prime. We asked people to sign up to this service, and they received information into their phone about sexual health. And because it was done automatically through the mobile phone for patients signing up, we were able to get thousands of high-risk gay men onto this service to give them information. It was very useful to give them information about PrEP, about condom use, and about what to do with testing. And we also were able to give them videos around sexual health. So it was a very innovative way and easy and cheap way of targeting people that we wanted to see more regularly for testing. And in fact, we're able to give people who are high risk almost like a VIP pass to their mobile phone, where we're inviting them to come in and test regularly for HIV testing. So I want to thank you for listening to my overview of the service at 56 Dean Street. I hope that's been inspirational for you to use technology, including rapid diagnostics, in your own services.